Hi everyone, this is Jenny Neal, exercise physiologist with OSF Healthcare. Today we're going to discuss ways to stay safe during exercise. Before beginning an exercise routine, consult your physician to make sure it is safe for you to do so. Our number one rule is to never push through pain to get exercise in. I'm sure you've all heard the saying, no pain, no gain. We do not believe in this. We like to say, no pain for the maximum gain, because it's true. If you're pushing through pain during exercise, you're increasing your chance of injury, which only sets you further back from your overall health goals. I do want to acknowledge that many of our patients live with chronic pain every day. When we say do not push through pain, know that we understand you live with it daily. We want to help you find a type of exercise that allows you to work within what you consider to be normal pain. The key here is trying to work with your body, not against it. Along with not pushing through pain, be sure to acknowledge that things like dizziness, unusual shortness of breath, sudden or unusual weakness, nausea, headaches are also abnormal during exercise. If you find yourself experiencing any of these symptoms during exercise, stop right away. If the symptoms do not go away within 5 to 10 minutes, reach out to your physician for further advice. With the exception of an increased heart rate and breathing rate, you should feel pretty normal during exercise. Let's move on to a few tools that can help us stay safe throughout our exercise journey. First up is our 2-hour pain rule. This applies mainly to those with any type of arthritis, MS, fibromyalgia, or those who live with chronic pain, but it's a good rule for anyone to follow. This rule is pretty straightforward. If you are in more pain 2 hours after exercising than you were beforehand, you've overdone it somewhere. This is when we'd want you to take a moment to reflect on your exercise routine and ask yourself, did I change anything this time that may have led to this pain? Maybe you increase the amount of time, the resistance, or the type of exercise. What can you change for the next time to be sure you do not have that pain again? Next up is the soreness scale. This helps us determine how sore is too sore after exercise and the difference between soreness and pain. It is important to note that while soreness is normal after exercise, it is not a requirement. You can have a good, challenging exercise session and feel normal the next day. So if you look at this scale, anywhere between 1 and 5 is considered normal after exercise. Between 1 and 2, you'll see it says not sore at all. This feels just like any other day. Between 4 and 5 is where you'll feel normal soreness. I typically describe this feeling as causing you to move a little slower, but you're still able to complete the things you had planned for the day. And that will help us decide if we are feeling pain or soreness. Is what you're feeling keeping you from doing the things you plan to, causing you to change your plans? If the answer is yes, you are likely feeling pain rather than normal soreness. This is where, once again, we'd like you to assess what you did in our exercise routine so we can change it for the next time and prevent having that pain again. At the end of the scale, between 9 and 10, you'll see it says unable to move from soreness. This is somewhere we never want to find yourself after our structured exercise. Again, it's understandable that sometimes our daily living activities can put us to that place. But when it comes to exercise we add into our day intentionally, we want to be sure that we're picking exercises at intensities that help us move and feel better, not worse. So, we've discussed how to be sure we don't push ourselves too hard during exercise, but how can we make sure we're working hard enough to make sure it's still beneficial? This brings us to our talk test. For the talk test, it is most useful for cardiovascular type exercise, such as walking, dancing, biking, or even marching in place. This test states that if you are exercising at an appropriate rate, you should be able to say 3 to 5 words to someone next to you. For example, if you are taking a walk for exercise with a friend or family member, you should be walking at a pace that you're able to speak in sentences back and forth reasonably. We would not expect you to talk like I am right now in full paragraphs, nor would we expect you to be able to barely answer with just 1 or 2 words at a time. Overall, with exercise, we should aim to find a middle ground where we feel a challenge during exercise that we are not struggling to complete in order to maintain a benefit while staying safe. If you have any further questions on staying safe with exercise, reach out to us via MyChart or by calling us at 309-282-1600.